Okay, let's talk masks. So, following up on our post from earlier about how everybody really needs to be wearing better masks that are more efficient for the new variant, Omicron, going around, and I'm sure everybody knows somebody who's sick right now. Um, we figured it was a good idea to show what the different kinds of masks are and how to wear them properly. So the first thing I'm going to go with is the KN95. These are they are a step down from an N95 because they aren't quite up to NIOSH standards. I believe some are emergency green lighted, but in essence, because these ear loops, instead of around the head pieces, it's not as tight to your face. So it can still let air leak. However, it's still much better than a surgical mask. It's also the cheapest option. So like win-win. So in order to put these on, you take the nose piece, you cup over the face like this, and you pull back around each ear, adjust, and then I always blow through, and if I can feel it on my eyes, it's not right. Um, but with these, because I have a small face, the entire bottom is open. So I don't like these kind personally because I don't feel protected. Okay, so before we get into the nitty gritty about N95s, gotta know a couple things. First off is that there are different types. There are flat folds and then there are molded. Flat folds look just like the KN95, where it goes over your face, kind of like a duckbill. And then there are molded cups where they are just little domes and they fit over your face like that. And before I go into showing how to put them on and how to take them off, which is referred to as donning and doffing, I'm going to show you just kind of what some different kinds would look like. So first things first, this is a Moldex brand extra small N95. It does not have a wire inside of it for adjusting, however it does have a foam piece. It has elastic head pieces that go over the back of the head. It is molded. This is technically meant for healthcare professional use because it also has fluid resistance, which is cool, but not necessary for everyday like personal use. So to properly wear them, you're going to have both straps in front, like this. You're going to take your hand, cup it in the front, place it over your face like this. Take the bottom strap right here, place it over your head like so. I always pull my hair through, so it's nice and snug like this. Then you take this piece, pull it up over your head. Always ruins your hair. Oh well. Pull through, because, you know, aesthetic. And then you mold the nose piece and adjust so that it is sitting on the top of the back of your head like this, and then the other piece is the base of your neck. This keeps it the most tight. And then to make sure that your seal is correct, you're going to want to cup your hands over the mask like this and inhale very sharply. If you feel it suck in, that means you've got a good seal. The other test is the glasses test, where you put your glasses on right at the tip here, and if they fog, that means you need to adjust your nose piece. Obviously, this does not replace fit testing, but in a pinch and in a pandemic, who's going to have access to that besides professionals? So this is the next best thing. And then to take off, you do it the opposite way. It is top strap first, and then cup like this. Pull it slowly away from the face, like this. Now it's cupped into this hand, which is now dirty. you're going to put it into a safe area, like not a plastic bag, like a paper bag, so that it does not stay moist from your breath, but it's also isolated and out of the way until next use. I usually do like 3 uses out of mine, but not consecutively. I keep a rotation of like 5. That way I know that the surface of each is clean. That's more based on like early 2020 data, so I'm not sure how much it holds up. However, gives me peace of mind. Next up is going to be a valved N95. This is a Honeywell. Same thing, only this exhale, puts others at risk. So you will need to wear a surgical mask over top of it. And I find these easier to breathe in. I find them more comfortable. But having the second layer on top kind of, it looks... I like it for aesthetic reasons, not to have to wear it, but it's functional. So same thing, put on there. Bottom first, top second. Adjust like so. Get my hair out of the way. Like this. Cover the valve. It inhale. If it sucks in, you're good. I indented myself. But yeah, pretty good. And for more size selection, this is also a Honeywell, and it is a size medium large. Notice there is no valve, which means it protects you and your neighbors. It's got the same beautifully cushy nose padding right here. I believe a package of 20 of these was $15.90 something. So not terrible. It has a decent mold to it. I don't find it as rigid as other brands, but I'm also not wearing this because it's a medium and it wouldn't fit. Okay, and the next of like the normal type masks that like you're gonna see around is the flat fold N95. So this looks a lot like the KN95, however, the little straps go over your head like the other ones. This keeps it tighter to your face, less likely to break the seal, which is what we want. The seal is the most important part to not getting sick or not inhaling whatever contaminant or what have you is around you. So, same thing. Open that baby up. Cute little padding here. These are Honeywells. So, same thing. Bottom strap, top strap. Cup your face. Pull it over. Ruin your hair. Adjust. Pull through. If you have a beard, also, it's going to affect the seal too. So you want to make sure you're very careful with that and make sure it's extra tight if you have facial hair, or preferably just trim the facial hair for a little while if you're going to be wearing these. So with this one, it's a little different than the KN95 because it's still tight to my face underneath here. This is all touching my face. So I actually have a seal right now. I just have to adjust the nose straps a little bit. But yeah, it passes the seal test, and it doesn't look too terrible. I can't complain. The breathability is pretty awesome. I don't really notice a difference between this and a heavy cloth mask. I'm talking perfectly fine. I don't feel any leaks coming out. Normally, you can feel the air passing your skin if you have a big leak. And you can also see as I inhale here, it's filtering. So yeah, pretty neat. So that's basically it. I'm obviously not like a certified qualified teacher in this type of thing. However, I am somebody who uses these items fairly regularly and professionally have had to use them for a while. So I know my way around respiratory PPE. I regularly get fit tested, have for almost a decade at this point. just quick and dirty to keep safe. Everyone at Rochester Mutual Aid Network just wants to make sure that our community is safe, healthy, informed, and doing the best we can. Mask up, stay vaccinated, get your booster, keep your distance, test regularly. Just be a good neighbor.